Good evening and welcome. You're watching Breaking Views, the show where we get you all the views so that you get the complete picture. I'm Sanket Upadhyay. Now there is something very strange happening in Rajasthan. After the budget, Rajasthan government budget, an announcement was made, a bill was introduced by the Rajasthan government called the Right to Health Bill. And since then, all private doctors, clinics, facilities, medical facilities across the state are on strike. There is a medical emergency in the state of Rajasthan where doctors are opposing the right to health. First, let's try to understand what exactly has happened. So, what is the Right to Health Act in Rajasthan, which has been introduced by the Ashok Gehlot government? So, this act says that there is a right to free emergency treatment without prepayment of fee. State government is liable to reimburse private facilities if patients are unable to pay post-treatment. Basically, this means that in a private clinic or a hospital, anyone can go, avail of the facilities, get treated, and then if that person is too poor to pay, the doctors in the hospital cannot force people to pay. The right to avail free healthcare at public and select private facilities, right to choose where to procure medicines and get tests done. Private hospitals will provide emergency service if government hospitals are not capable, and hospitals and doctors will have to pay fines up to 25,000 rupees if this act is violated. Now, it is this act and certain provisions of this act which has not gone down well with private doctors in the state. Why are they protesting? Let's tell you that. Private doctors have gone on strike and have halted all services in the state. They say the government is shifting its own responsibility to private doctors. Emergency cases not clearly defined by the act. So who defines what is an emergency? For an individual, something may be an emergency, but in medical terms, it may not really be an emergency. The act, doctors say, may provoke patient's family to assault if healthcare is denied. Doctors are vulnerable to the whims of state health authorities. No transparency in how government will reimburse the private facilities. No provision in budget for reimbursing private facilities. So the government says that it will provide a reimbursement, but where is the budgetary allocation? Remember, I spoke about the budget. The Rajasthan government has presented an extremely ambitious budget in the run-up to elections. Now, what all is going to be free under this new law and what constitutes an emergency according to the government? Accidents, animal bites, pregnancy complications and other emergencies defined by state health authorities. So this, the doctors say, is a certain amount of ambiguity which needs to be addressed. So this brings us to the most important question. And before we ask that question, one has to understand that this strike has led to a situation where patients are suffering. You see, not everyone can go to a government hospital. The private hospitals provide a much needed infrastructure, and when they are shut, the load on the government hospitals, already under stress, has increased manifold. The doctors say that they have their own logical reasons. The government on its part says that private facilities have received enough aid and assistance from the government. Surely they can do this much for the poor. So on Breaking Views, the question that we are asking is this: why are Rajasthan doctors opposing a pro-poor law, and whose explanation is better? I mean, do we need a law like this? Perhaps yes. Do we need it in its present form, or can it be subjected to some improvement? Some of the doctors say yes. Others are saying scrap this law completely. It cannot exist in its present form. Let's quickly, first, before we introduce our guests, make you listen to some of the patients who are really suffering in the state because of this strike.
हमारे घरवाली के हार्ट की प्रॉब्लम है, दोनों बाल डैमेज है और सीरियस है, और रात को 4 बजे का है, लेकिन कोई डॉक्टर कोई भी एडमिट नहीं ले रहा है। बस दे दिया गोली और यहाँ एडमिट नहीं लेंगे, यहाँ कोई डॉक्टर नहीं है, कोई कह देता कुछ भी नहीं है, एडमिट ले रहे नहीं है। 4 चक्कर लगा दिए, यहाँ से वहाँ जाओ, SMS चलता है, वहाँ जाओ, इसमें क्या नाम धनवंतरी में 4 चक्कर लगा दिया, परेशान और बैठ गए। कोई खाना पीना कुछ नहीं खाया, इसके चक्कर में बैठे। अब क्या करे भी क्या।
मेरी बच्ची को थोड़ा प्रॉब्लम हो रहा है, हार्ट में प्रॉब्लम था, तो मैं एक्सरे के लिए यहाँ आई हूँ आज, पहले भी आई थी, कल भी आई थी। यहाँ माहौल ऐसा ही है, कोई पता नहीं है कब क्या होगा, ना तो कोई ढंग से बात करता है, ना कोई ढंग से जवाब देता है। अब प्रॉब्लम ये हो रही है कि बच्ची सफोकेटेड हो रखी है इस समय। मैं एक्सरे के लिए वेट कर रही हूँ हार्डली आधे घंटे से। मैं खुद पहले मेडिकल डिपार्टमेंट में रह चुकी हूँ, तो एक्सरे में आपको 20 मिनट से ज़्यादा टाइम नहीं लगता है। यहाँ पे एक एक डेढ़ घंटे के लिए बैठा दिया जाता है कि आप बैठो। बच्ची भी जाके आ चुकी है, मैं भी 3 चक्कर काट चुकी हूँ, अभी भी रिप्लाई मिला है कि आप बैठो, हम पहुँचा देंगे। अंदर जाके पूछते हैं तो कोई रिस्पॉन्स नहीं, आप बैठो, हम पहुँचा देंगे।
हमको वहाँ से गंगापुर से रेफर करा गया हुआ है। उनने मतलब SMS में भेजा था। उनने सवेरे एक मतलब है नहीं वो ऑक्सीजन लगा के यानी और एक बार वो करके और उनने वहाँ से यहाँ के लिए रेफर कर दिया कि पर्ची धनवंतरी के लिए भेज दिया था। और धनवंतरी में आए थे हम, तो उनने नहीं ये कहा कि मतलब है नहीं ये नहीं पेशेंट है नहीं मतलब भर्ती नहीं होगा।
25 तारीख को रात को आया था मैं 11:30 बजे के करीबन, तब से लेके अब तक है ना कोई ट्रीटमेंट नहीं किया। बोलते हैं कि उधर बेड पे जाके बैठ जाओ, डॉक्टर आने वाले हैं। अभी तक कोई डॉक्टर ने आके नहीं चेक किया।
Joining us right now on this extremely important discussion, because remember, people are suffering. And now more doctors are expressing their solidarity from neighboring states as well, from Uttar Pradesh and other associations related to the Indian Medical Association. Dr. Ashok Sharda, he is the IMM past president, Rajasthan state IMA and also the national VP elect of IMA. Rakhi Rathore, BJP spokesperson. Dr. VB Singh is the principal and controller of the JLN Medical College in Ajmer. And in just a short moment, we'll also be joined in by Dr. Anshul Avijit, national spokesperson of the Congress party. Dr. Sharda, I want to begin with you first. Why do you oppose the Right to Health Act? What is wrong with the Right to Health Act? What is wrong with providing free medical help to those who need it in the state of Rajasthan?
See, the name of this act is not correct. This is not right to health. This is planned for accident emergency treatment. So, right to health word includes so many things. According to WHO, the definition of health includes the complete state of well-being, physical, mental, and spiritual. So, if you consider health, then there are so many things which are to be seen before implementing this law. Right? Right to have good food, right to have shelter, right to have good air, right to have good environment, and so many things in our mental peace and the spiritual health also. So this is not right to health. This is the right to treatment belong. So health is a broad perspective and it does not include, it is not there in the Supreme Court.
No, but Dr. Sharda, are you, see, you will be accused of getting too hung up in the mechanics of what right to health is. I'm just trying to understand from you because, you know, been seeing pictures of the protest. There are people suffering right now. In the entire state of Rajasthan, we have a weird situation where there is absolutely no clinic, no private hospital, no ambulance plying on the road, only government establishment. Now clearly government establishment alone cannot support the healthcare apparatus of the state. So if by extension you are requested to do the same or you are asked to do the same, not requested, where is the problem?
Sir, we are not asked to do that because if the government finds that the government system is not complete to serve all the citizens of India to the whole of the population because it's so much of health burden on these institutions. So once you consider that, the private hospitals are making up and they are contributing more than 70% of the healthcare system
I'll tell you
of
what
the country.
The allegation is.
So
Dr. Sharda, the allegation is that the private hospitals would love to get land at affordable rate from the government, would love to get all sorts of aid from the government, but when the government would want them to support the poor in the state, they would then complain that what will we do? This is your job, not our job. How do you respond to this allegation?
Once you talk about the aid, there are only 1 to 2% of hospitals, they are free of cost land or subsidized land. Otherwise, 98% of the private hospitals are made up by the own, their purchase of land in the market price, building up and equipped, well equipped, done by the doctor himself. and all the things are being developed by the doctors, not by the government. So if government want to implement this act, they could have gone for a pilot project for initial 1 year to show the solidarity of this act in the government institutions only. If you are successful in this pilot project, then try to take up in confidence to the private hospitals and the doctors of the state, and then you must go for the second step in the private setups.
Okay. Dr. VB Singh, Dr. VB Singh, how do you respond? Dr. Sharda says that at least launch a pilot project first. Don't just straight away go for the jugular.
Thank you very much, Sanket, for inviting me in an elite panel of dignitaries to discuss the important issue, that is the right to health bill, which is recently passed in the Assembly of the Rajasthan. Before replying your question, I'll tell you a few words and a few lines about the health status in the Rajasthan. You know, the Rajasthan is the state where the COVID management was in top. You agree? I think you will agree. The maximum health-related schemes announced and fully implemented in the Rajasthan, as I named as MNDY, MNJY, Mukhyamantri Nishulk Nirogi Rajasthan Yojana, and Mukhyamantri Chiranjeevi Swasthya Bima Yojana, which has been started with the 5 lakhs of insurance cover. Now it is up to the 25 lakhs. So in the Rajasthan, the health facilities and the health schemes are very much on top. I can say this bill, Rajasthan, this right to health bill Rajasthan is the only state where our government, our CM decided to give this right to the poor people or the people of the Rajasthan of more than 8 crore persons. In this context, the state government led by the Chief Minister and the Health Minister, and another milestone, you can say this is the real milestone. I think in the country there is no any other state where this bill is there.
No, that is true. But Dr. Singh, that also gives many doctors like Dr. Sharda, they shudder to think of the consequences. They feel that many will have to shut shop. They will lose business because everything is, according to them, very loosely defined. What constitutes an emergency? What is the whole model of reimbursement?
Sanketji, when the bill is passed in the assembly, the government will decide, government will define the emergency. There is no issue, there is a law will be formed, or there is a rule will be formed. They will decide, they will define the emergency. They will define the way of this reimbursement. They have already decided that there is a single window reimbursement, and everything will be decided with the consultation with the doctors, government doctors, private doctors, NGOs, and even in the assembly.
No, was this act before being passed discussed? Let me ask this question of Dr. Anshul Avijit. Anshul Avijit, did you consult the doctors in Rajasthan before going ahead with a bill like this?
Sanket,
I mean, on the face of it, it provides health care to all. It's a very noble cause. But how do you practically achieve this? You've heard the concerns of private doctors.
No, sure. No, first of all, let me just congratulate, the government of Rajasthan for what I feel is, as you've put it, it's a highly enlightened, it's a broad-based, non-discriminatory, humanistic bill. I mean, I'm surprised it's not there. It wasn't there before. It's almost existential in its particular nature. And what can be better than a bill that serves to protect life? It is not sacrifice on the altar of commercialization.
While I understand all of this, Dr. Anshul Avijit, my question is that right now you have a situation where all clinics, all private hospitals, all private facilities in a state which your party rules are shut. People do not have medical assistance. They're troubled. So who's to be blamed for a situation like this? The crisis is right now.
The bill was sent to a select committee. There were wide-scale consultations before it has been passed, made into an act. So therefore, many things in any kind of bill, no bill is infallible, right? You always improve on it. You feel that whenever it's enacted, what are the kind of loopholes? What can be the lapses? What can be the plugs that can be filled? I mean, even the Supreme Court goes back to its earlier judgments and revises them continuously. So this, it
you
is
feel
not that it is
there is
etched
scope
in
for
stone.
improvement. Given this backlash by the doctors, would you be willing to make changes as suggested, at least sit with them and see how you can make this work?
No, you must understand the spirit of the bill. It is a composite welfare scheme of Rajasthan that has the Chiranjeevi scheme that was earlier mentioned. You have urban MNREGA. There is a composite program of welfareism in Rajasthan, and this is a part of that program.
But how do
this
you,
can
how
be
do you
more
tackle the
enlightened
situation
than this.
right now?
If
You see the
commercial institutions...
Anshul Avijit, the crisis right now is that medical facility in the state has completely collapsed. It is at the mercy of only a few select government hospitals and government facilities. In any case, they're overworked, and there is more pressure.
We are urging the doctors community, the private doctors. Nobody is against private doctors. We think that they are private medical institutions and practices are essential to a country like India. I mean, the government certainly cannot cover them. The point is that sometimes what happens is when prompt action is needed, there is always other considerations. There is commercialization that takes over, and we end up losing precious lives. This was meant to fill that. Now, if doctors have an issue, we will talk with them about it. Doctors have gone on strike before. Once I remember a lot of doctors went on strike during reservations on the issue of reservations itself. So, if they have certain fears.
No, but Dr. Avijit, I hope you realize one cannot afford to be so casual about the fact that doctors have gone on strike, that it happened before. A lot of things happened before and we would not want them to happen again. Will you or will you not admit that there is a huge crisis right now? Huge, massive crisis. People are
all fears
they're having to
will be allayed. We have tried to convince them that this is in the larger benefit of the welfare of the people. This is forward looking. This is an enlightened bill. And yes,
so you're saying you're going to convince, and what if the main demand is that this law or the bill be taken back?
Our position is, look, this is a welfare measure. Look at the spirit of the bill. Look at our commitment to health and welfare. Now, there is enough evidence, there is anecdotal and formal evidence of gross commercialization in many sectors. I'm not saying that everyone is culpable. I'm just saying that this is to surmount that. Now, if people have a problem, we will talk about it.
Okay.
This is a democracy.
Okay, Rakhi Rathore of the BJP. How do you view these developments, and do you think that this could have been handled better? We have a crisis right now in the state.
Definitely, we are facing a kind of very serious medical emergency in the state, and from last 13-14 days, the medical facilities have come to a standstill like situation in Rajasthan, and the people, they are suffering. I will say that not people, the doctors are also suffering, but there should be a solution. In fact, the irony is that the state government was not able to take the stakeholders into confidence. That is the basic problem. They were not able to convey their point to the doctors that why they want this kind of bill. In fact, the doctors should be heard, and there should be a middle way. We also want that the people of Rajasthan should get
Ms. Rathore, do you support this bill?
They should get, but definitely with amendments. As you told, there's no model of reimbursement. In fact, from their past experience, the fellow panelists, they mentioned Chiranjeevi Yojana as well. I just want to convey this, that the Chiranjeevi Yojana, the doctors, they are not getting their amount in there. In fact, they are not reimbursed on time, and that is why they are protesting in this case, because from their past experience, because the Rajasthan government announces very so many schemes, but on ground level, their schemes are not implemented properly. And this is the problem with the Chiranjeevi Yojana. Many big hospitals are not enrolled with Chiranjeevi Yojana, and the hospitals who are enrolled, they don't get their reimbursement on time. And that is the basic problem here. The definition of emergency is not clear. I think the government should step in, and they should actually have a dialogue with doctors and should solve these apprehensions from the doctor's side.
For those viewers who do not know what Chiranjeevi Yojana is, this is a scheme that has been launched in Rajasthan by the Ashok Gehlot government, where, and correct me if I'm wrong, Dr. Anshul Avijit, where you provide some sort of an insurance to people, affordable healthcare and insurance where then they can go and
25
avail of
lakhs
these
now.
medical facilities. But do you hear what Ms. Rathod is saying? The problem is doctors are not reimbursed on time. So given this track record, they are questioning the efficacy of a scheme like Right to Health Act. Not the spirit of the scheme, but its implementation.
Lakhs of people have already benefited under the Chiranjeevi Yojana. Many job cards have already been given under urban MNREGA. OPS has already been enacted in the state, which is meant to benefit our aging population in the best manner we think possible.
Which brings me to my next question. How are you going to fund so many schemes? I mean, we see poster
There is no
poster
budget
in
provision,
Rajasthan.
Sanket.
Welfare
There is no
is a matter
budget
of
provision for
priority.
RTH also.
You don't break the budget. Sanket, it's a misnomer. You don't have to break the budget to have welfare schemes. If the
Then how do you
government
fund
cuts down
them?
on national health budget, the government has cut down, ironically, in the years after COVID on the national health budget. Now, if you cover inflation, there is no increase at all. I mean, there's a depreciation. Can you imagine this?
Okay,
Our
Ms. Rathod's
target
reply.
in the national health budget was 2.5% of the GDP. It's barely even 2%.
Okay, Rakhi Rathod's reply. See, my point is I keep coming back to the immediate crisis. While we discuss how noble this bill is, we also have to keep in mind that right now the healthcare infrastructure in the state of Rajasthan is completely collapsed. It is at the brink of collapse in government hospitals.
Actually,
yeah.
Dr. Anshul is claiming that they have spent a lot of amount on health infrastructure. I just want to share some data with you. We have 80 trauma centers in Rajasthan, but none of that trauma center has full faculty. In fact, all the medical colleges which were opened by the state government, in fact, most of them doesn't have any neurosurgeon, any cardiac surgeon, and anyone to take care in case of emergency. And that is a basic problem. In fact, I do agree with Dr. Shada. They should have implemented this through their government hospitals like Satellite Hospital or medical colleges. In fact, they claim that in 2018, they promised the local people that they will bring RTH bill. But they should have.
But Ms. Rathod, here is a fundamental question. How can it be justified that doctors almost hold the entire state to ransom? That you will decide
we can't justify that. And,
you can't justify.
And this is because of lack of, they were not able to convey their point to the doctors in Rajasthan, and that is the problem. In fact, that is the base of the problem.
You think provisions of the Essential Services Maintenance Act should be pressed into service? Let me ask that question to Dr. Singh.
Definitely it should be there because the people are
in
moving
Rajasthan,
to
it's called
outside states for their
RESMA.
treatment.
Do you think RESMA provisions should be pushed into service right now?
Whatever you can do, you should do to give proper medical facilities to the people of
Dr.
Rajasthan
Singh.
Because they are suffering and they are moving to other states for the medical facilities. In fact, not each and everyone can move to other states. So this is a very high point. In fact, and government should step in to take strong actions.
Dr. Singh, do you feel in the state of Rajasthan, Essential Services Maintenance Act should be pressed into service?
I don't think so. We can resume the services after dialogue. This is not the way to implement this RESMA.
Okay.
At this point, I'll also tell you that in the Rajasthan is the only state where all districts have medical colleges. For the Rakhi, I'm just for her knowledge, for every medical college, when we start the medical college at the MBBS level, we have the basic subjects. Neurosurgery, cardiac surgery, these are the tertiary care.
Okay, the problem is, Dr. Singh, right now, I would have loved to go
Sanket, please.
Yes, I'm running out of time, Dr. Singh. That's the problem.
Because the facilities in the Rajasthan, health facilities in the Rajasthan is the top in the all states in the country.
Okay, now that's your claim.
Not at all.
That's your claim, which will kickstart another debate. I'm going to have to stop here. Ms. Rakhi Rathod, Dr. Anshul Avijit, Dr. VB Singh and Dr. Ashok Sharda. The only reason why we are discussing this to not discuss how noble the cause is. Of course, everybody must get affordable health care. It happens in many countries. But how effectively are we implementing it? And there is a crisis right now. Who's responsible for that crisis? And should doctors also, who have gone on strike, blame themselves a little? Good night and goodbye.